employers hear the phrase self-insurance, the reaction is almost always the same. That sounds risky. What most people don't realize is that employers are already carrying enormous risk. They just don't control it. In this episode, we're going to talk about the difference between health insurance and stop-loss insurance, why those two things are governed by completely different rules, and why misunderstanding that difference keeps employers locked into unnecessarily expensive plans. By the end of this episode, you should understand one key point. Risk isn't the enemy. Uncontrolled risk is. Health insurance versus stop-loss insurance. Two very different things. Let's start with a basic distinction that almost no one explains clearly. Health insurance and stop-loss insurance are not the same thing. They are regulated differently, they behave differently, and they exist for different purposes. Traditional health insurance is governed by rules that prohibit underwriting based on health risk. Insurers cannot price premiums based on how healthy or unhealthy a group is. That means a workforce made up of young, healthy employees is pulled together with older, sicker populations across the market. Risk is averaged, costs are socialized. That's not an accident. It's how the system is designed to work, but it has consequences. Who actually pays for that averaging? Most employers, especially small and mid-sized ones, have relatively young, working-age employees. Many are healthier than the general population. They exercise more, they're still working, they're not yet heavy utilizers of healthcare, but under fully insured health plans, that doesn't matter. Their premiums reflect the average risk of the entire insured population, not their actual workforce. In practical terms, this means many employers are subsidizing the healthcare costs of older, less healthy populations elsewhere in the system. Again, that's not a moral judgment, it's just mathematical reality. When underwriting is prohibited, low-risk groups pay more than their expected costs. High-risk groups pay less. That cross-subsidy is baked into the structure. How stop-loss changes the equation. Stop-loss insurance operates under a completely different framework. Stop-loss is not health insurance. It is catastrophic risk protection for employers who self-fund their health plans. And unlike health insurance, stop-loss can be underwritten. That means stop-loss carriers actually look at the size of the group, the age distribution, historical claims patterns, plan design, risk mitigation strategies. In other words, they price risk based on reality. For employers with younger, healthier populations and with good plan design, this often results in lower total cost, not higher risk. This is where the fear narrative breaks down. Self-funding does not mean no protection. It means different protection structured around catastrophic risk instead of routine care. Why stop-loss gets blamed for the wrong problems. Where self-funded plans go poorly, stop-loss is often blamed. But stop-loss is rarely the problem. The real drivers are usually poor plan design, uncontrolled access barriers, delayed care, misaligned incentives, and lack of cost transparency. Stop-loss simply prices the consequences. When costs are high and volatile, stop-loss premiums rise. That doesn't mean stop-loss failed. It means the underlying system wasn't controlled. And blaming stop-loss misses the point. Here's the key takeaway from this episode. Employers are already carrying risk. The question is whether that risk is invisible and average or visible and manageable. Health insurance hides risk by spreading it. Stop-loss exposes risk so it can be controlled. And for many employers with younger, healthier workforces, the current system means they are paying far more than their actual risk justifies. In the next episode, we're going to talk about where risk actually comes from and why underfunded, fragmented primary care is one of the most expensive mistakes employers make. Before you go, be sure to subscribe to our YouTube channel, share this episode with your CFO, HR leader, or benefits advisor, and watch this series, Why Primary Care is the Most Expensive Thing You're Underfunding. Thanks for watching.